And it's complicated because I believe that people that have tested negative in the States have had to pay for their testing. So that's going to be a disinclination, isn't it? And I also believe in some areas, you can correct me if I'm wrong on this, that people have to, if they're tested positive, they have to pay for their quarantine. So there's a financial penalty if they are negative and there's a financial penalty if they're positive. That's not going to encourage people to go for testing. That concerns me greatly. We can't criticise China and Iran for not being transparent if we haven't got clear indicators of what is actually the state of play on the ground in the great United States of America. So something needs to change there, I think. Now, the UK, which is the focus of today's talk, 51 confirmed cases. Now, the government says we are in the containment phase. We're not yet gone on to the delay phase. So we're trying to contain it now by finding out who had it, contact tracing. But the numbers are going up, and not all of these can be epidemiologically related to other cases. So a containment phase, my government say we're not yet in the delay phase. After the delay phase, we carry on with research and treatment and the mitigation stages as well, where we try and minimise the damage done by this infection. So my government's published an emergency plan today. Now, I get a lot of emails saying we don't trust our government, but having experienced some situations where there's no government, pretty well any government is better than no government. So we've got to go with what we've got. So regardless of your political views, we have to unify here, and that means we need leadership. So in the UK, that's the UK government. I think we just have to go with that. If you disagree with it for the time being, we still need to move together as a single people. And that applies all over the world. We need to move together as a single humanity against this common enemy. So symptomatic people should self-isolate. Now, this is all advice that comes from either the British Prime Minister, the British Chief Scientific Advisor, or the British Chief Medical Officer, who gave a large press conference this morning and dealt with questions in what was a fairly reasonable way. Although I do have a critique, I still think they're still delaying things. They are still waiting to react to situations rather than being as proactive as I would like to see. Because I've been going on about this now since January, and I'm very sad to say that the suspicions I've had and the things I was warning about back in January or February, early February, are coming to fruition now. And people are now reacting. I just so wish I'd been wrong, but tragically it appears I haven't been. So I still feel we're being reactive. That's the point I'm trying to make. We need more proactivity. Anyway, so symptomatic people should self-isolate. As we've discussed, that's easy if you live on your own, more difficult in a family, but as much as we can. Containment stage is finding and isolating infected people. We are working flat out. The health authorities are working flat out on that in the UK at the moment. And we'll need to do so in every country. I'm just talking about the UK now as an example, really. Containment will not make sense after there's a lot of cases, though. So when will we go from the containment phase into the delay and research and treatment phase? That is when containment no longer makes a lot of sense. So at the moment, containment and delay strategies are both containing and delaying. So they're both good. But when the virus is widespread with widespread community transmission, as unfortunately is going to happen soon, I believe, then we're left the containment phase because we can't do that anymore and we move on to the delay phase. Now, features to look for. Difficult to tell because it's very similar to influenza. But fever, dry cough seems to be the characteristics. Now, sore throats and runny noses do occur in this condition, but it tends to be later on. So it's these sort of lower respiratory features that seem to be the earlier features. And the other thing that a lot of people also complain of is undue fatigue. They just feel really, really tired. And this myalgia, the achy muscles, just achy all over. So fever, dry cough, achy all over. feeling unwell, undue fatigue, then self-isolate, go home, pick up the telephone, dial 111 and ask for advice. We need to cooperate on this, and the last thing we want is infected people going round infecting other people. So it really is time for a community coordinated effort on this. Now, my government is talking in these terms now: severe prolonged pandemic. Pandemic means the disease is present in many countries and continents of the world, and that it is community spreading. And in other words, it doesn't come from known epidemiological links to an epicenter such as Wuhan or Hubei. And this is what is happening now in many places.